High uric acid levels are a common health concern, but understanding what uric acid is and how it impacts our health is crucial. Uric acid is a natural waste product found in your blood, created when your body breaks down purines. Purines are substances found in certain foods like red meat, shellfish, and alcohol. They are also naturally present in our cells and tissues. While purines and uric acid are normal components of our body's metabolic processes, issues arise when the body either produces too much uric acid or fails to eliminate enough of it through the kidneys. This excess uric acid accumulates in the blood, leading to a condition known as hyperuricemia. Hyperuricemia can be silent for a long time, but when it crosses a threshold, it can trigger various health complications. Excessive uric acid in the body can crystallize, forming sharp, needle-like structures that deposit in the joints. This leads to the painful condition known as gout, characterized by sudden and severe joint pain, swelling, and redness, most commonly in the big toe. Gout attacks can be so intense that even the weight of a bedsheet can feel unbearable. However, high uric acid doesn't just cause gout, it can also affect the kidneys. The crystals can build up in the kidneys, leading to kidney stones and, if left unchecked, even chronic kidney disease. Beyond joint pain and kidney issues, high uric acid levels are increasingly being recognized as a marker for other health risks, including cardiovascular disease and metabolic syndrome. So what causes uric acid levels to rise in the first place? Diet plays a significant role. Consuming large amounts of purine-rich foods such as red meat, organ meats, certain seafood, and alcohol can increase uric acid production. Sugary beverages and foods containing high fructose corn syrup also contribute to higher uric acid levels. When you drink sugary sodas or eat processed foods with added sugars, the fructose in these products is rapidly metabolized, leading to an increase in uric acid production. However, diet is just one piece of the puzzle. Genetics also play a key role. Some individuals inherit a predisposition to produce more uric acid or have a reduced ability to eliminate it through the kidneys. Obesity, insulin resistance, high blood pressure, certain medications, chronic stress, and a lack of physical activity can further exacerbate the problem. These factors create a metabolic environment that favors the accumulation of uric acid in the blood. Uric acid is not just a byproduct of metabolism, it is also considered a surrogate marker for oxidative stress. Oxidative stress refers to the imbalance between free radicals and antioxidants in the body, leading to cellular damage. Elevated uric acid levels often indicate increased oxidative stress, which is associated with a higher risk of cardiovascular diseases. Studies have shown that hyperuricemia can contribute to the development of conditions like hypertension, atherosclerosis, and even heart failure. When uric acid levels are high, it can trigger inflammation in the blood vessels, contributing to the narrowing and hardening of arteries. This can increase the risk of heart attacks and strokes, making high uric acid a crucial marker for assessing cardiovascular health. Therefore, managing cardiovascular risk factors, such as high blood pressure, high cholesterol, diabetes, and lifestyle habits like smoking, becomes a vital part of the overall strategy to manage high uric acid levels. Recognizing the symptoms of high uric acid can help in early intervention. In its initial stages, high uric acid often does not present any noticeable symptoms, which is why it can go undetected for years. However, as the condition progresses, individuals may experience sudden and severe joint pain, swelling, and redness, commonly in the big toe. This acute condition is known as a gout attack. Other joints, such as the knees, elbows, and fingers, can also be affected. Additionally, high uric acid can cause persistent discomfort in the kidneys, indicating the formation of kidney stones. If left unmanaged, hyperuricemia can lead to long-term complications, including permanent damage to the kidneys and joints. Elevated uric acid levels are also increasingly linked with metabolic disturbances, including obesity, diabetes, and heart disease. Managing high uric acid requires a multifaceted approach, beginning with lifestyle and dietary changes. Reducing the intake of purine-rich foods is a crucial step. For instance, you should limit consumption of red meats, organ meats, and certain seafood. Instead, focus on a balanced diet that includes plenty of vegetables, fruits, whole grains, and lean proteins such as chicken and plant-based options. Including low-fat dairy products may also help reduce uric acid levels. Drinking plenty of water is another essential strategy, as it helps flush out excess uric acid through the urine. Proper hydration is particularly important for those with a history of kidney stones. Limiting alcohol consumption, especially beer, is also important. as alcohol can increase purine breakdown and decrease the kidney's ability to eliminate uric acid. Physical activity is another key factor in managing uric acid levels. Regular exercise helps maintain a healthy weight, improves circulation, and reduces insulin resistance, all of which can contribute to lowering uric acid levels. For individuals who are overweight or obese, gradual and sustained weight loss is recommended, as it can significantly decrease uric acid production and enhance its elimination from the body. However, it's important to avoid crash dieting or extreme fasting, as these can temporarily increase uric acid levels and potentially trigger a gout attack. Instead, aim for a consistent routine of moderate exercise, such as walking, cycling, or swimming, combined with a balanced, nutrient-rich diet. In some cases, lifestyle changes alone may not be enough, especially if high uric acid is driven by genetic factors or underlying health conditions. This is where medications come into play. Doctors might prescribe uric acid-lowering drugs such as allopurinol, febuxostat, or probenecid. These medications are typically indicated for patients who have experienced frequent gout attacks, have visible deposits of uric acid crystals called tophi, or have kidney stones caused by uric acid. They are also used when uric acid levels remain high despite lifestyle modifications. Allopurinol and febuxostat work by inhibiting the enzyme responsible for uric acid production, while probenecid improves the kidney's ability to excrete uric acid. Regular monitoring of blood uric acid levels is essential to ensure that treatment is effective and to prevent complications. An emerging area of interest in managing high uric acid and its associated health risks is mesenchymal stem cell, MSC therapy. MSCs are known for their anti-inflammatory, regenerative, and immunomodulatory properties, which can be beneficial in conditions marked by inflammation, like gout and other forms of arthritis. Research has shown that MSCs can help modulate the immune response, reducing the inflammation associated with elevated uric acid levels and potentially mitigating joint damage in gout. Additionally, MSCs release growth factors and cytokines that promote tissue repair and reduce oxidative stress. Since high uric acid is linked to oxidative damage and cardiovascular risks, MSC therapy may offer a protective effect against the damage caused by chronic hyperuricemia. Moreover, MSCs have shown promise in improving kidney function by reducing fibrosis and inflammation in kidney tissues, which is particularly relevant for patients with uric acid-related kidney disease. The regenerative properties of MSCs can help in repairing kidney tissue, potentially enhancing the body's natural ability to excrete uric acid more effectively. While MSC therapy is not a direct treatment for lowering uric acid levels, its role in managing the complications and systemic effects of high uric acid makes it a valuable adjunctive approach, especially in patients with chronic inflammation, joint damage, or kidney impairment. However, MSC therapy is still an area of active research, and patients interested in this treatment should consult with healthcare professionals specialized in regenerative medicine for personalized guidance. Remember, managing high uric acid is not just about avoiding painful gout attacks. Elevated uric acid levels have been linked to a variety of other health problems, including heart disease, metabolic syndrome, and kidney disease. By taking proactive steps to control uric acid levels, you can improve your overall health and reduce the risk of these associated conditions. For example, studies have shown that lowering uric acid can lead to improvements in blood pressure control, potentially reducing the risk of cardiovascular events. Additionally, some research suggests that managing uric acid may have a beneficial effect on insulin resistance, offering another potential benefit for individuals at risk of metabolic syndrome or type 2 diabetes. In summary, high uric acid is more than just a risk factor for gout. It's a sign that the body's metabolism and oxidative balance might be out of order. Elevated uric acid levels serve as a warning sign for increased cardiovascular risk and can indicate a higher level of oxidative stress in the body. Therefore, addressing high uric acid is crucial not only for preventing gout and kidney stones, but also for protecting your cardiovascular health and overall well-being. Through a combination of dietary modifications, lifestyle changes, medical interventions, and potentially advanced therapies like MSC therapy, you can keep your uric acid levels in check and improve your quality of life. It is always advisable to consult with your healthcare provider to develop a personalized plan tailored to your health needs. Regular checkups, blood tests, and lifestyle adjustments, along with managing other cardiovascular risk factors, can go a long way in managing uric acid levels and preventing long-term health complications.